hello dosto. So today I want to discuss and talk with you. So also today we'll discuss about the neoplasma related ICD chapter. So you can easily understand in this scenario how we can code, how can we check that guidelines related things. So let's see these all things. I hope you will understood the scenario, and if you have any questions, anything, you can reach out to me so I can explain these all pointers with you. So neoplasm are abnormal growth of the tissue like of the body. So types we are talking the type that will be coming here. You will see that scenario. So will be coming here. You will see that scenario. Types, if we are talking about the types that will coming like that, malignant generally spared to the other organs or a cancerous part. So you can check that scenario here. You will be see that thing. So it will be make you understand. So first type is that is you need to focus that is malignant, generally spared to the other organs or cancerous. Second type is there like a benign mass of cell tumors that lacks the ability to the invade neighboring tissues or metastasize a non-cancerous. Third point is a carcinoma in situ spread within the organs but does not move out to the organs. So there are three kinds of the neoplasma. You will be able to see here that will be like making you more understand. So really help you when you are trying to find the ICD coding guidelines. Types of the malignant neoplasm. So we'll see here the two types. First is a primary site of the origin of the malignant neoplasm organ from where the neoplasm oriented. So these all points you will be understood from which location the first time cancer or neoplasm was identified. That will be coming into the like primary. Secondary another name is a metastatic cancer or like neoplasm. That will be organs to where the neoplasm has sphered. It means that primary organ was a different and secondary location is a different. That time we are think why we are seeing that is a secondary. For example, primary organ was the liver and secondary cancer goes to the lungs. So we can identify. Note there are no tertiary neoplasma, no tertiary or more than is things. We do not have only we have a primary or secondary neoplasma. So you can get this kind of notification and then you will be see the things and you can go right. So let's move to the next slide. You will understood the table of the new plasma, how this table is working. So it will be helping you. I will be little zoom so you can see that scenario. Okay. So neoplasma table. If we are talking about a neoplasma table, so you will see that neoplasma table. It's divided into the malignant, car in situ, benign or uncertain behavior, and unspecified. So major classification in this table, you will be able to see that that is a malignancy, Second is the car in situ, C in situ, or benign, uncertain behaviorals, and unspecified. So first we are going with the malignancy. Malignancy divided into the primary, where it was originated. Secondary, that is also known as a metastatic, where it spreads or like reached. Third is the CA in situ, that is the encapsulated or pre-malignant neoplasm. Third is the benign non-malignant. Fourth is the uncertain behavioral, that is the inconclusive. Fourth is the unspecified, that means that not specified as a cancer or tumor. So in that scenario, you need to focus and work on that. Second point we need to check, what we need to check, that you must have to know that point what it should be there. So guideline that is related to neoplasma, must know that always you should have aware of these things, how it will be work, and then you can understand the scenario. So just I zoom it so you guys are be able to see that. So whenever we are coding ICD code for the neoplasma, always check for the types of the neoplasma before assign the code. So first thumb rule is here. First you need to identify or assign the types of the neoplasma. What is the type of neoplasma? That is a malignant, benign, current situ, like that. As above, we are seeing that the table. So that type we need to recognize malignancy in situ, benign, uncertain behavioral, unspecified. These all information we need to identify first. Then we are moving to the overlapping site. Code should end with a 8. Example is given C17.8. These are a primary malignant site next to the each others within the same organ. If the affected sites are not adjacent gives the code for each site separately. What the meaning of that? The primary site of malignancy site next to the each others within the same organ. Like two organs are merged together and you are not recognize identify which is like a correct code, which is a correct thing. So that time you need to code those both. If the affected site are not adjacent, give the code for those each site separately. Second guideline is coming like that: malignant neoplasma of the ectopic tissues to be coded to the site of origin. Example here given: ectopic pancreatic malignant neoplasma involving the stomach are coded to pancreas unspecified. For example, tumors, carcinoma, carcinoids, adenomas, etc. First look the word in a alphabetic index, then in ICD first reach to the alphabetic index, then you go to the neoplasm table if indication, and then reach to the tabular list. So this is the best practice for the find the ICD codes. For example, if the documentation indicate the adenoma refers to the terms in alphabetic index, review the entries. You will see here, if the documentation indicates the adenoma, refer to the terms in alphabetic index to review the entries under these terms. The instructional notes see also neoplasma sites benign. The table provides the proper code based on the types of the neoplasma and the site. It's important to select the proper column in a table that correspond to the types of the neoplasma. The tabular list should then reference to verify the correct code has been selected from the table and that more specific sites does not exist. So we need to check and cross validate all these types. Okay. So you will see the sequencing guideline rule. You will be able to find that what is the exact guideline for the neoplasma. So we are discussing these all points. So I'm just moving into the fit position. If you have any guideline, any concern, please comment it. Sequencing is always based on the reason for encounter RFE. Like reason for encounter sequencing is depends if the patient has a primary and secondary neoplasm. If patient having a primary secondary neoplasm, the sequencing will be based on which neoplasm treatment was directed at the time. Example, find the diagnosis for 61-year-old female patient is a small cell carcinoma of the right lower lobe of the lungs. So please try to find that which CPT code, which ICD code will be there. I just told that C34.31 the correct answer. Please check and find that what difficulty you are getting, and please comment if you have any additional suggestion for this code. Okay. Next, guideline related to anemia due to malignancy as a reason for the encounter. First, specify the neoplasm C or D series code. Second, anemia due to neoplasm, that code will be D63.0. This site is only case. This is the only case where the reason for encounter is not coded sequencing first. So this is the exception rule when the patient present for the anemia and patient having the malignancy, and that malignancy anemia related to malignancy. So we are coding the malignancy code primary. Then we are moving to the anemia code as a secondary. Example, patient admitted for the anemia finally confirmed that anemia is due to terminal carcinoma of the central portion of the right breast, and the treated for the same code we are coding C50.11, that is related to cancer, and D63.0 that is for the anemia. So those are like a basic information. You should have to know these all points so you can understand what is the codes and what is the guidelines. Okay. So anemia due to chemotherapy, immunotherapy, and radiation therapy as a reason of encounter for the chemotherapy and immunotherapy. First sequencing will be here anemia. Second sequencing will be neoplasms like a C series or D series. Third is the adverse effect of the anti-neoplasmatic and immunosuppressive drug that will be coming from the T45 1.X5 series code. So we need to select the three code. First is the anemia, second is the type of neoplasma, and then adverse effect of the radiation therapy or immunosuppressants. For radiation therapy, we have the same sequencing, like first is a anemia, second is a neoplasma, third code will be going with for the radiotherapy causing abnormal reaction, that will be Y84.2. So I hope this guideline will be help when you will be coding for the neoplasma or cancer. So next guideline related to coding you will be see here, that will be sequencing guidelines. You will be seeing that above. If you have any confusion, any concern, don't feel shy. Ask that question. Management of dehydration due to malignancy. So that time primary dehydration due to malignancy. First sequencing is the dehydration. Second sequencing is a neoplasm. Treatment for the complications resulting from the surgical procedure. First code will be the complication, second code will be the neoplasm. Admission encounter for the pain control or pain management. First code will be the neoplasma related pain, that is a gene 89 series, and neoplasma is a secondary code. Malignant neoplasma in a pregnant patient, we need to code that 09A.3 as a neoplasma related combination code with a pregnancy code, and neoplasma code will be the secondary code. Okay. So in this way we are coding the procedure and list, so you will be understood these all things. So next guideline that is related to Neoplasma, I hope these all points are going to clear for you. And if and you are not getting any point, don't feel shy, just comment it. I will be explain once again. Primary malignancy previous excised. G85 for the history of neoplasma can be given only when the no further treatment is directed on the site that has been excised or eradicated earlier. History code can be used along with the code for the secondary neoplasm if the primary is eradicated. Eradicated. If the treatment is still on the excised neoplasma, it is as a active neoplasma. Please note it. If the treatment is still on the excised neoplasma, it is coded as active neoplasma. In a remission code that is coming C90 series, the meaning of remission is a curing, healings, codes for the leukemia, myeloma, etc. have the term remission in the code description, which requiring to be given by the physician. If the disease has been cured completely, Z series codes for the history should be used. Example is here Z85.6. There are also code for the code in a relapse, which mean it was cured and has reoccurred. So in relapse means that some problems was cured, after that it reoccurred. Dismaniated malignancy neoplasma. Example is here C80.0 can be used when the patient has advanced metastatic disease and no known primary or secondary site of a specific. Like if you are not aware of that which site is there, so that time you can use this code malignant neoplasma without a specific site, right? Malignant neoplasma without a specification of site. C80.1 diagnosis is just malignant neoplasm. The code should be such neoplasma malignancy, malignant primary symptom signs and abnormal findings listed in associated with the neoplasma. Never quote the sign and symptoms when the definitive diagnosis is provided unless indicated by the alphabetic index or tabular list. So I hope these all points will be helping you in a future, and when you are doing the coding, if you are a fresher, be focused and be attractive for that. And if you have any guideline related queries or questions, feel free to discuss, feel free to comment. I will be going to explain each and every rules. Next is their pathological fracture due to neoplasma. Sequencing is based on the reason of encounter. So please focus. This is the first term rule. Sequencing is based on the reason for the encounter. If the treatment is directed at the fractures code, first pathological fracture M80.4, 84.5 will be code primary. Second is a neoplasm, that is like that. Secondary code patient admission encounter solely administration for the chemo or radiation therapy. That time we are coding like that. Therapy code is a primary, neoplasma related is a secondary. Therapy is Z51.0 is an encounter for the anti-neoplasmic radiation therapy, or Z51.11 encounter for the anti-neoplastic chemotherapy, or encounter for the neoplastic immunotherapy. These kind of codes are there. So that much information we are discussing today, and remaining slide will discuss into the next slide or next video. So let's move to that. So thank you guys for seeing and being coming to the this session. If you have any question, any concern, feel free to discuss it, and I will explain each and every guidelines that is related to ICD coding. Any updates will discuss that. Thank you so much.